1. Preliminary data note a decrease in the 2020 national suicide rate, but do not provide information broken down by demographics. 2. Experts say this data should be interpreted with caution, as the pandemic's mental toll may not appear directly in the data. 3. The pandemic has led to more explicit conversations about mental health, which can work to inform and improve policy, education, and daily life. With pandemic lockdowns, social isolation, and economic insecurity taking a mental health toll on the nation, many hypothesized a rise in suicide rates during the past year. But new preliminary data from the Centers for Disease Control and Prevention, CDC, shows a 5.6% decrease in the overall suicide rate in the U.S. during 2020. Still, experts note that we may not understand the complex interplay between the pandemic and how all its ripple effects, on the economy, job security, personal safety, and mental health, impact suicide. The data was published in JAMA Network in late March. However, there are a few factors we do know. Anna Muller, Ph.D., professor of sociology at the University of Indiana who studies adolescent suicidality, tells very well. The first is that the CDC data is preliminary and should therefore be interpreted with caution. It usually takes the CDC 2 years to produce this data in a clean and rigorous fashion, she says, so we should keep in mind that the numbers are provisional and subject to change. Additionally, Muller says 2 other factors should be taken into account when considering the data: the fact that they do not offer breakdowns by demographic, and that suicide rates are not the only indicator for mental health.